My name is Jonathan Forgash. I'm a chef here in New York. My company is called Servana. And what I do during the day is I'm a private chef for people in treatment. Stem cell, T-cell, chemo, radiation, somewhere in the recovery to wellness stage. I also do consultation by phone or Skype with families around the country who are, setting up their kitchen for the first time, whether it's for a neutropenic diet or just how to set up and get going for people who never cooked before. I do lecturing at Hope Lodge and Gilda's Club and some other organizations doing this, either cooking demos or speaking about different approaches and different problems that arise in the home between patient and caregiver. Once you leave the hospital, in your home, you're in charge. The doctor is support, the nutritionist is support. So one of the very simple things you can do to empower yourself is cooking. And by starting to cook for yourself, you're taking on some important rituals. Some would say it's mindful cooking. I would just say that by cooking for yourself, you're empowering yourself to take care of yourself. So when I approach my clients in their home, I talk about recipes for health. It's not something from the doctor and the nutritionist. They're recipes that are delicious and they're good for you. So I come at it through the culinary side rather than the nutritionist side. And personally, I think a chef-driven recipe is going to be more delicious than When I first started cooking for one client, my first client, I used to be in the film business. I catered TV and film and fashion all over New York. I had an executive producer that I worked with for a couple of years, called me out of the blue that he had stage 4 lymphoma. He was coming out of the hospital with a stem cell transplant and he was going to be quarantined for the first 100 days at home. Would I be his chef? And I said no, because what do I know about cancer and cooking for that? I cook home cooked meals from around the world to give the cast and crew a break in the middle of the day. And he said, that's exactly what I want. I think home cooked food, like my mother cooked for me, might actually get me to eat. And so I started cooking for people based on this idea of what I call food with emotional content, meaning when I give just a straight up lecture, we often do a visualization to start off, and I'll just talk you through it now. I ask people to close their eyes, and we've all done a meditation, and think back to, let's say you're 10 years old and you're homesick and you're bundled up cold, you have a fever, and in the kitchen is your mother, your auntie, your father, grandfather is cooking whatever it is that your family cooks for someone when they're sick or they're not well or they're depressed or sad. And I would ask you to picture that dish, because now you're sitting at the table and your grandmother's hands are putting that bowl in front of you. What is that dish? I bet you can taste it if you thought about it. You can smell it. You could picture your grandma serving you that dish. And the first time I did this, I had 75 people in a room, all like you in some step of the process. People were smiling, and I was really shocked, and I realized that it's really true. These dishes have more of an effect on you than just feeding you. We were talking about processed food. If you're eating soup out of a can, okay, it's giving you nutrients, but how do you feel? If you came down here and I had your mom here cooking for you and everybody else, so food with emotional content, food with sense memory. Food, taste, and smell are very, very powerful memories. And a little bit of that in your life right now, I feel will go a very long way. Every person I cook for personally, this is the approach, and this is what I teach. So, correct? All right. For all of you caregivers out there, one of the biggest questions I get is, I don't know what to do. My wife, husband, mother, father, I'm taking care of them for the first time. I am now the parent, and I'm cooking for them, and I'm making all of his or her favorite foods, and they hate me, and they're not eating it. No matter how much I make, no matter what I try, no one's eating. And all of a sudden, you now have this daughter who was trying to be the parent and take care of her mom. The roles are now reversed, because now the mother who's sick is now feeling really bad and now putting in even more energy consoling the daughter, when it's supposed to be the other way around. The reason is, it's not your cooking isn't bad, it's them. They're in treatment, chemo, radiation, depression, right? The surgery itself or whatever it is, it's affecting their appetite and their taste. So one, in my family, I would have, my go-to would be to make an overabundance of food to show how much I love my mom. Well, guess what? If she's in treatment, she can't eat maybe a big bowl of pasta or soup. She can eat this much. So when she eats this much, and I look at all I have left over, and she's hurt my feelings, it's not. I didn't do anything wrong. I'm trying so hard to make my mom happy that I can't see the truth for what it is. She can't eat that much, and I can't seem to understand that she's trying to tell me it's not my food, that's her appetite. She's telling the truth. But because you're in such a close relationship with whoever you're taking care of, and you're trying so hard, sometimes you can't see it. So I'm telling you in advance, if this arises in any way, shape, or form, it's not you, it's them. I was at a conference about 2 years ago, and it was for nurses going onto the oncology ward for the first time. And they were talking about stress reduction and emotional issues for the nurse and the patient. And then the nurse practitioner in charge said, we're starting to realize that caregivers are experiencing stress, trauma, and emotional upset in the home. They're just realizing that this is an issue. I know you all already know this. So for you caregivers, please take care of yourself. The number one reason, given that the caregiver does not take care of themselves, is guilt. How can you take a break? How can you go for a walk? How can you go to the movies if the person you love is home sick dealing with cancer? That's ridiculous. Well, the truth is, you're the caregiver, you're taking care of your husband and your job and maybe your children and maybe some more of the bills and maybe more of the shopping and maybe everything. So if you don't take care of yourself, how can you take care of your loved one? And that might be falling on deaf ears right now, but maybe tomorrow afternoon, this might help. It should also help to know that every family that I work with, every home that I've been in, this is very, very common. All right, you are not alone. There's a lot of groups out there, and I bet you that the person you're taking care of would love to hear this because they probably love you a lot, and we're all in this together. I'm sorry if I've upset you a little bit, but this dawned on me that I'm not just a chef anymore in someone's home. I get to see a lot of this, and people coming into this for the first time don't know what's coming down the road. So I seem to be lecturing more and more on these interpersonal relationships, issues that arise, pitfalls. I find that just like food with emotional content, a little more help and understanding in the home is probably even more important. And there's a cookbook author in California. Her name is Rebecca Katz. Does anybody here know her? She has a book called The Cancer Fighting Cookbook. Invented an idea called FASS, F-A-S-S, and all of you should Google this. It stands for fat, acid, salty, sweet. The idea was that I'm cooking for John, I am his caregiver, and the soup that he has always loved that I am making, and I have his mother's recipe for it, all of a sudden after a month he says, Jonathan, this is disgusting, what did you do? Now he's upset enough that he doesn't realize that it's him, he's blaming me because he's lashing out, and that's fine. But it's him. Right now, you're in treatment with chemo?
Chemo and radiation.
Yeah, and guess what? That's affecting him. Everything tastes flat. So what Rebecca realized was, it's not the chef's fault, it's not the wife or the husband's fault, it's him. So what do you do about that? Rather than go back and try to change the recipe every night, you know how at your dining room table you might have some salt and pepper? Mm-hmm. Well, include some fat, olive oil, vegetable oil, avocado oil, butter if you want, acid, maybe lemon if you're out of treatment and you can do that, some red wine vinegar, sherry vinegar, get some champagne vinegar, something fancy. Salt, well, salt, you got different kinds of salt if you want, sea salt, and sweet, sugar or honey if you're staying away from processed. So it works like this. John complains that the tomato soup tastes flat like cardboard. Well, a little drop of that lemon juice or vinegar will pop the flavors. It tastes flat and boring, a touch of salt with that. Jonathan, this tomato soup, it's so acidic, it's burning my mouth. I have sores from the chemo. Well, a drop of olive oil or vegetable oil, the fat will help round out those flavors. Well, and prebiotics is the idea of what's the point of putting organic carrot seeds into your garden if the garden is fertilized with processed fertilizer, right? So if you're putting probiotics into your gut and you've been sick, or you've been eating westernized processed food all your life, it's really not going to help as much as if you were putting probiotics into a strong body. So prebiotics is this very simple idea of strengthening your stomach, your gut, your body. If your gut and stomach are stronger, you react to stress better. So less IBS and less upset stomach and less nausea, less fatigue, right? All these stresses on your body. So what are prebiotics? They are fruits and vegetables that have long chains of carbs that don't get processed at first, so it gets down into your gut, and that's what the probiotics thrive on. So you're strengthening your body for what's to come. Bananas are wonderful for prebiotics. Leeks, asparagus, garlic, scallion, chive. So there's a way to strengthen your body just by eating really good food. I am convinced that this is absolutely a very simple thing that's going to become a very powerful tool, especially for people between diagnosis and treatment, or treatment and recovery.